Hello again. Sorry for the wait. I was just running a little bit of a check on her vitals. But how about we talk a little bit more about her symptoms? I can maybe ask a few more questions about, family history of the patient. But let's just start with something really simple, okay? Has she been around any sort of animals, anything that could have, potentially bitten her by any chance?
What am I doing there? I don't know who she is.
I'm your mother, don't you remember? She's been forgetting a lot of things recently. Referring back to your question, she hasn't been bitten by any animals, at least not that I know of.
Okay, well, her vitals came back really, really normal. Great blood pressure, BMI looks amazing, and temperature is perfectly normal. So, you know what I'm thinking? I'm thinking we should maybe do a quick reflex test, if that's okay. Got my little trusty knee jerker here, okay? I'm not gonna hurt you, Tamron. Just gonna quickly do a quick tap on your knees, okay? All right. Perfect. I'm gonna do it one more time. Great. All right. Now let's just do the other knee. Awesome. Great. Okay. How about I do a quick vision test on you? Okay, it's gonna be very simple. Nothing like when you go to the eye doctor. Just gonna ask you to focus on my finger. All right, and just focus on my finger as it moves. Awesome. Okay, now I'm gonna hold up some fingers, and you're gonna tell me how many fingers I'm holding up. Okay, Tamron? All right. How many fingers am I holding up?
4?
Right. Alright, how about now?
3.
Okay. How about now?
4.
Interesting. Okay, so, like I mentioned, vitals are perfectly normal. I did her knee jerk test and her reflexes look great, so there doesn't really seem to be any sign of muscle atrophy, which is perfect. I am a bit concerned about the vision though. She seems to be exhibiting a little bit of double vision. So maybe I can look more into that.
It's very strange because she said that she was updated on all of her vaccines, so I don't know what it could be.
Oh, okay. Well, that's actually very helpful information. How about I go and run a quick check on all of her vaccinations? Thank you. All right. Hello again, guys. Thank you so much for being very patient. I did get to check up on the vaccination records you mentioned. All right. So far I see, yes, I see meningitis, the vaccine for that. So she's perfectly clear from meningitis, which is great. I remember we saw no lack of muscle atrophy. Muscle impairment was perfect. Oh, okay, great. And I see the polio vaccine. Up to date. Oh, and you mentioned that she wasn't bitten by anything earlier. Let me look for rabies really quickly. Oh, okay, awesome. And she's gotten her vaccine for that as well. So polio is definitely out of the question. That's awesome.
So what could it be then, doctor?
Well, let me ask you something. Did you guys happen to travel outside of the United States within the last 3 to 6 weeks by any chance?
Yeah, recently we went to the UK, but I'm not sure what that has to do with anything.
Okay. While you were in the UK, did you happen to consume any sort of meat products, specifically beef?
Yeah, we went to this really nice restaurant. Tamron had this special beef stew.
Okay. Thank you for letting me know. I appreciate that. I do have a little bit of a hunch as to what I believe could be going on. Now, have you ever heard of Creutzfeldt-Jakob disease?
No.
Okay. Well, I believe Tamron might have a variant of Creutzfeldt-Jakob disease, which is primarily a neurodegenerative disorder of the brain, and it is transmitted by infected tissue. In this case, the ingestion of infected tissue, which could be from the beef stew Tamron had while you guys were in the UK. So when a person has to ingest such tissue, and it's infected, it's usually infected with prions.
Oh, what are prions?
Good question. I'm glad you asked. So prions are essentially misfolded proteins, and once a person is exposed to misfolded proteins in the form of prions, it kind of inhibits the normal conformation of proteins throughout your body, causing other proteins in the brain to also misfold and thereby inhibit normal functioning and regulation. So that might be the cause of a lot of Tamron's hallucinations and maybe even the double vision we saw earlier. And I know that's a lot of information to take in, so feel free to digest it all and sit with it.
But how can we be sure of this?
Hi again, guys. Thank you so much for your patience today. I know that waiting can sometimes be a lot, but I did get back the MRI results to compare a normal healthy brain to Tamarin's. Along with that, I did just finish completing my Western blot analysis on the CSF that I collected from the spinal tap.
I don't want to take any more tests.
It's okay, you don't have to take any more tests.
Well, okay, so there's no easy way for me to say this, but the MRI results, as I'm looking at them right now, do show an increase of flare signal in Tamarin's brain. And this signal is essentially what is causing the malformation due to all the presence of the prion proteins that are showcasing these abnormal symptoms in her. Unfortunately, this is a very classic sign of Creutzfeldt-Jakob disease, or CJD.
What else can we do? What about the spinal tap?
Well, yeah, so the spinal tap, from my findings, are also showing an increase in the type 2B protease inhibiting prion disease protein. And unfortunately, I'm seeing this increase in a lot of the same areas where I saw the flare protein increase from the MRI. So unfortunately, that does confirm my diagnosis of BCJD, at least in Tamarin's case here today.
Are there any cures for this prion disease?
Okay, well, most patients do not receive a cure, as symptoms primarily present within patients like Tamarin tend to lead to an early decline in life. Most patients don't live longer than 10 to 12 months upon initial diagnosis of BCJD, and I know that could be a lot to take in for you today, but I promise you I will try my very best to treat Tamarin in this case to the best of my ability.
Thank you, Doc.
Of course, we'll work together on this.